So we're broadcasting. My name is Robert Theobald. I am the Vice President of Small Business Services at the Arizona Commerce Authority. I'm also the Small Business Ombudsman here at the Arizona Commerce Authority. And I'd like to thank you all for joining us this great Thursday morning for the Small Business Boot Camp and Resource Collective webinar, helping to prepare small business to return stronger through this epidemic, the pandemic. We appreciate the community partners that have been helping us out throughout this program. They've been extremely helpful. Can't list them all, but here's a large chunk of the community partners that have been key to the success of our boot camp. So the Arizona Small Business Boot Camp and Resource Collective is designed to help prepare small businesses, targeting businesses of 20 employees or less, to emerge and return stronger through the COVID crisis. Again, it's open to any size business, and every size business we feel can gain some positive information from these boot camps. So you are all very welcome to be here, and we appreciate your attendance. This is a statewide initiative supported by the community partners that they listed on the previous slide. And it's a daily boot camp. We're going to continue it through June and keep increasing our resource collective as part of that. This week's topic, of course, Monday was a holiday. On Tuesday, we had navigating the new guidance on PPP forgiveness. Yesterday, we had a great session on reopening your restaurant. And today is our safety in the workplace. Every Thursday, we partner with the National Safety Council to do a safety in the workplace session. And Friday, tomorrow, is marketing to return stronger. It's going to be a great session on branding and helping you develop your brand for success. Some quick updates. The biggest update is there's still over 100 million remaining as of May 27th. So there's definitely opportunities for businesses that have not applied for PPP to get a PPP loan. If you have applied and you're still waiting to hear from your bank, definitely follow up with your lender. And you may look at one of the other local lenders that is a little more agile with that application process. As we had mentioned before, Arizona has, through round 1 and 2, Arizona small businesses have received over 73,000 loans, totaling over $8.5 billion from just the PPP. When you combine in the EIDL loans, Arizona small businesses have received over $9 billion in funds to help get through this crisis. So I want to make sure that everybody knows the different support services that the ACA has and different programs. In small business, we can help you navigate through the SBA and connect you with the great Small Business Development Center, SBDC programs. We have local banking contacts and update with the latest developments for small businesses. Our workforce division is working very closely with Arizona at Work and providing opportunities both for employees and employers to find their workforce and return stronger. And a manufacturer, our Manufacturing Extension Partnership Program, is recognized nationwide for their success, and they're a great team to work with to help improve your manufacturing operation. Also, we want to mention the Arizona Together website for the state with all the information related to COVID-19 and the different resources. And we've also compiled the different guides to help businesses to reopen, whether it's a restaurant guide or a retail guide, barbershops and cosmetologists. We've assembled these links to these different resources and guides to help your business as it returns to work and have some of this direction. Additionally, we don't want to forget mentioning our website, azcommerce.com/COVID-19. Please visit this, and we have up-to-date information. We keep it current, and it's changing just about every day with new updates regarding small businesses, regarding businesses, and the resources for COVID-19. So today we have Ed Tobby's going to be speaking with us from the National Safety Council. Amber couldn't make it today. She's out in the field with some clients, but we've got Ed with us, and he's going to talk about how we can be safer. So we appreciate his time today. And I'm going to stop sharing my screen and turn it over to Ed. Ed, you are up.
There we go. Good morning. How's everybody doing today? We're coming to you live from the Arizona Chapter National Safety Council. My name is Ed Tobby. I'm one of the trainers here. And at our chapter, we offer a wide variety of safety training for the workplace, at home, on the highways, and at play. Our real strong suits are first aid CPR training and instructor development. And then we also are very, very strong in roadway safety. So we have a variety of defensive driving type courses that we offer both for individuals and for businesses, and ticket dismissal and license reinstatement. So we're really big on that area. But we also offer training for lift truck operators, construction zone flagger, advanced safety certificate courses, which is principles of occupational safety and health, safety training methods, safety management techniques, incident investigation, ergonomics, job safety analysis. So there's a wide variety of trainings that we do offer for the workplace. And as I mentioned, my name is Ed. Typically, Amber joins us. Amber is the president of Safety Help Today, and she's also one of the trainers here at the Safety Council, but her main job is that she does safety consulting, inspections, she does OSHA compliance. So she's a wealth of resource out in the field to help businesses improve their safety programs and keep their workers safe, whereas I'm more on the training side of things. So let's talk about our goals today. And we've done a number of these presentations, and we've kind of tweaked them out as we've gone along. And we did a kind of a baseline return to work a couple weeks ago, and this is kind of back to work 2.0. It's like, what do we do now? We're back, we're open, we have customers coming into our establishments, we have employees returning to work, and everybody has a little bit of this, uncertainty edge to them. And the goal here is to try to put people at ease, build confidence, both with employees and with the consumers, that it is safe to come into our businesses. We are open. We want to try to get back to some sense of normalcy, whatever that is. But we're trying to help people have a comfort level that everything's going to be fine. And really the ones that are most at risk are the ones that have other pre-existing conditions. So if you're not in one of those categories, it's pretty safe to go out and make connections back with those businesses that we've dealt with before. So the effects on the workplaces, we have a change in operations. We know that there's been some reductions in customer capacity when stores have reopened. They're monitoring how many people are in, how many people are out to try to ensure spacing. There's workspace redesigns, checkout areas that retailers have, all these signs and stickers on the floor and directional kind of guide things. We've got some physical barriers that have been put in place. And all just, walking around seeing these kind of things, gives people a little bit of a feeling of uncertainty. But once again, we're trying to minimize that, because as people get back into their businesses and customers come back into your establishments, as they see these, they're going to become kind of a new normal, and we're all going to kind of adapt to that. And those stress levels are going to go down, and the uncertainty levels are going to go down. And certainly as the case numbers with COVID continue to decline, I think we're all going to feel a lot better about ourselves moving forward. So how's it spread? And we're not going to go into a lot of detail here because we've covered this quite a bit in the past, but primarily through large respiratory droplets that, because of gravity, 3 to 4 or 5 feet is their spread rate. And so that's how they came up with the 6-foot distancing. It's enough space to allow these large droplets to either fall to the ground or fall to some other surface. So because of that, a secondary source would be a contaminated surface that you might touch with your hands and then touch your face, mucous membranes of your eyes, nose, mouth, and then that's the entry point into our body. Recently, CDC has kind of downplayed a little bit of that source, and they're more focused still on the large respiratory droplets. Prolonged contact with aerosols is, if you see in the picture of the man sneezing, you have the large droplets that are heading downward, you have the aerosols that are kind of lingering around. And it's that prolonged contact with aerosols that can also be an entry point. But this is much more common in places like healthcare, where you have a lot of people in small spaces and you have more of these aerosols that are continuously circulating, and you have more prolonged type exposure. In the general spaces like an office or a restaurant or a construction site, those aerosols dissipate much quicker. So the virus does remain active for about 3 hours in aerosols, about 4 hours on copper, up to 24 hours on cardboard, and 2 to 3 days on plastic or stainless steel. And that's where the continual cleaning of surfaces is going to come into play, to try to eliminate on those types of surfaces. Getting to OSHA, one of the things that's really important from the OSHA standpoint is this general duty clause. Because OSHA does not have a specific set of guidelines or for COVID, they've issued some guidelines on how to react and how to comply, but they haven't issued new standards. But the basic general duty clause says employers have an obligation to make sure that your workplace is free of hazards. And those hazards could be safety hazards, physical harm type things, but it also involves safety and health. And that's where the virus comes in. It's more of a health hazard than it is a safety hazard. So you do have an obligation as an employer to make sure that you're providing a workspace that is free as possible from those types of recognized hazards. And at the same time, your employees have an obligation to follow those rules and standards and act in a responsible manner to protect themselves. So it's not all on the employer. The employees have responsibilities as well, okay? So where do you start? And that's kind of, we're back, we're open. Man, I'm kind of confused. What do I do? On a basic level, it would be a good thing just to start off by cleaning your facility. Just make sure, obviously if you've been closed for a long period of time, nobody's been in the building, your risk level is extremely low because the virus would have died on its own. But if you've had people in and out of the building on a regular basis, maybe you were partially working from home, or maybe you were open with some very limited kind of capacities, then you want to maybe look into a little bit more thorough type cleaning process, right? You want to assign a leader or maybe even a committee or a task force to help you guide through this process. On the surface, it seems pretty overwhelming, but if you get more people involved, it's certainly going to be much more helpful, and you're also going to get much wider variety of opinions and thoughts because people have different job assignments and different responsibilities. So getting that cross-section of ideas and thoughts and opinions is really, really important. You want to try to determine what your potential exposure is for your type of business and identify if there's any gaps in that. And along those same lines, as you're doing a job hazard or safety analysis or some sort of analysis having to do with health, you want to start to develop a preparedness plan and disease prevention plan that's going to identify some of those risks and some of those gaps that you might have. And when you're assessing risks, you want to assess 3 different things. The 3 E's is what we call them. That would be everything, everyone, and everywhere. And that sounds overwhelming, but you don't want to just focus your thoughts and your investigation on one type of thing, kind of look at a much bigger picture and then start to break down those things as you proceed. Now, when we have this return to work orientation program, that's going to help build the confidence and put people at ease. Here's what we're doing. Here's our processes. Here's what we've done. We've cleaned this. We've done this. We have a new program in place that's going to help you, the employee, be safe. And for our clients and customers, we're also developing these processes to make sure that they have confidence coming into the building. And to do that, you have to have really effective communication. So you want to communicate those changes, not only what they are, but the why behind them is really important. You want to be supportive. Make sure you encourage that two-way communication with your associates. You know, this is not a dictatorship. This is a community effort, a team effort, and we want people's feedback on how we can do things, because even your entry-level employee may have an observation or a thought that could be super important. So you want to get everybody's perspectives on these things. We want to focus on the positive changes to reduce that fear and anxiety. And we also have to acknowledge that if people have been off work for a period of time, we don't know what kind of issues they've had to deal with at home or wherever their alternative arrangements have been. And so you have to be aware that there could be some mental health issues, there could be some substance abuse issues, there could be just some different things, because this is all new to people, and trying to adapt can be a challenge. So as the employer, just kind of be alert to these kind of things, and if you need to consider some accommodations to assist those people, you know, please be open to doing that. So kind of a where do you start place is right here. I put this link up early, and I would encourage you to write this one down. I'm going to leave it on the screen while I'm talking. If you have no other idea what to do, start here, because this landing page and the other pages associated with have just a wealth of information on standards, the latest updates, how to do a hazard recognition assessment. It provides some great medical information, and it also has some really good industry specific guidelines. So it breaks down, hey, if you're a taxi driver, you should do this. If you're on a construction site, you can do this. If you're in an office building, try these things. And so it's a really incredibly strong informational resource page. This is what it looks like when you get there. Under the news and updates, you have a lot of great information, but on that highlights tab, you see underneath there, and I know the font is pretty small, but it breaks it down to long-term care facilities, pharmacies, restaurants, all these different subcategories. And same thing under the control and prevention tab that's on the right side of the page. It also has some very specific recommendations based on various industry segments. So I would encourage you, if you're not sure where to start, what to do, start here. And you can get about 75% of what you need addressed right on that page. So one of the things you want to try to do is do some sort of hazard or safety analysis. Now, in the safety world, when we're talking about these are predominantly on the safety side to try to identify hazards or safety issues, but the same process and procedure can also be used on the health side of things. And what you want to do is you want to take and break down your jobs into more simplified tasks, right? And so an example of a job would be, I'm an electrician, but a sample of a task is I need to change out an outlet on the wall. So you want to address that outlet change and identify the steps, what the potential hazards are there, and then what kind of controls are you going to put into place to accomplish that task safely. And the same process can be used on the health side of things. So let's say you're a hotel owner and you have the people at the front desk. what kind of hazards would they be exposed to? And these are not necessarily on the safety side. Yes, there's some in slips, trips, and falls and other kind of things there, strains, ergonomics. But from a health standpoint, what is going to be their exposure of people coming into the building and having contact with them? What kind of process do we have to take care of as far as their work areas, their surfaces, and those kind of things? And so if you look at it from that perspective, you can go through this same process and develop these plans. This is an example of a form that we use. It's a very basic form. At the top, it just has some information you're filling in, your title, your job, the supervisor, plant. But if you look at the sequence of basic job steps column, then the middle columns, you identify potential hazards. And then in the right-hand column, you're going to recommend some sort of action, process, procedure, or control is what the term we use, in order to mitigate the hazard, right? That's what we're trying to do is mitigate that hazard. And there's different ways to do this. And we're going to go into that a little bit deeper in just a minute. But when we're talking about emergency preparedness, now I acknowledge that the COVID situation doesn't necessarily fall into the emergency category. It's more of a healthcare disease prevention preparedness plan. But since we're talking about effective planning and OSHA, OSHA does require businesses, especially once you get beyond 10 people, to have an emergency preparedness or emergency action plan. Now, this is geared more toward if an emergency happens at your facility, a fire, some sort of outside force, weather, those, if anytime you might have to evacuate your building, is how do you get out and where do you go and how do you account for the people? And OSHA has a great evacuation plans e-tool on their website. If you just Google evacuation plans or emergency action plans and e-tool, they have on their site, you can just fill in the blanks. You can create one of these emergency action plans for your business in about 10 minutes. And it meets all the OSHA standards. So for most small to medium-sized businesses, it's not more complicated than that. You just have to think about what can be the potential things I need to address. How do we evacuate the building safely in an orderly manner? How do we identify whose responsibilities to do what? And then how do we count for everybody during this process and afterwards? So that's on the emergency side. On the disease prevention side of things, that's where we want to think about an industrial hygiene. And industrial hygiene is a specific category of topics that address physical, biological, ergonomic, and chemical type hazards. Now, when we're dealing with a virus, we're going to focus on the biological side because that's where the big issues are. But in addressing the biological side, we can also start to incorporate some chemicals as far as cleaning type chemicals that we're not used to using. So that's why I highlighted both the biological and chemical, because they're both going to come into play. And the industrial hygiene process involves 5 steps: anticipation, recognition, evaluation, controls, and then confirm that everything's working. And you just start over again, and you have this continuous loop of anticipating, recognizing, evaluating the risk, controlling, and confirming, and just keep going. And the main standards that we're going to be using for this are the bloodborne pathogen standard, the personal protective equipment standards, and respiratory protection standards. These are all OSHA standards that are listed on the screen. And when we're dealing with biological hazards, these can come in a number of types of exposures. They could be bacteria, virus, fungi, or other living organisms that can cause acute and chronic infection by entering the body. In occupations that deal with plants or animals, food or food processing, laboratories, medical personnel, or any occupation that might result in contact with bodily fluids pose a risk, and the bloodborne pathogen is really going to be very helpful in that. When we teach at the Safety Council, we teach bloodborne and airborne pathogens. So we kind of lump both of those together in our training. And so it talks about not only what do you do with a needle stick or an open wound or some sort of blood exposure, but also, with people sneezing and the flu and how some of these diseases are transmitted through airborne type things. Chemical hazards can be in form of solids, liquids, gases, mists, dust, fumes, vapors. They're done by breathing, absorption through the skin, or ingesting, eating, or drinking things, or injection, maybe a sharp object, or maybe even a short blast of very focused air can be an injection type thing. So airborne chemical hazards exist in concentrations of mist, vapors, gases, fumes, and solids. So we wanted to kind of throw out that introduction to industrial hygiene because this is where you really want to go. And as I mentioned just a couple minutes ago, when we're doing this analysis of our workplace, we don't want it to be overwhelming and complicated. We want it to, keep it simple, start with the basics, and then just keep growing and expanding as you work through various areas of your building. So I want to stress that, yes, there are some very complicated issues surrounding this entire subject, but on your level, where do you start? Start simple, keep it simple, and just keep growing with it as you gain more data. So we'll start with just some general precautions. And these, once again, these have been around since the beginning of this, when we identified this virus. And actually, these have been around, for previous flu epidemics, right? So if you're sick, stay home. It's that simple. If you have symptoms, don't come to work. And as employers, we have to be a lot more flexible with these policies because we want to make sure that we're protecting everybody as much as we can. And yeah, are there some people that might take advantage of that? We accept that, but it's much more important to err on the side of safety. Social distancing is something we've all heard a lot about. 6 foot, try to keep your distance. Using respiratory etiquette. If you do sneeze into a cloth or a Kleenex or into your elbow. Increase hygiene and sanitizing policies, frequent cleaning of surfaces. And then there's a lot of debate and a lot of discussion about PPE, right? And there's various levels of face coverings versus PPE that's much more considered a respirator. So we're gonna go into that in just a couple minutes as well and give you a little bit more guidance there. But in the safety world, we love this particular upside down pyramid, and it's referred to as the hierarchy of controls. And as you can see, the line on the left, as you go from the bottom to the top, you go from less effective, which is the PPE at the bottom, to more effective, which is eliminating the hazard altogether. So what we want to try to do when we're dealing with any kind of hazard is, if we can eliminate it, that's perfect. And that you don't have to do much else. If you can just eliminate the hazard completely, you're good. If you can substitute that hazard, maybe the hazard is you have a toxic cleaner that you have to use in your business for a specific reason. And if you could substitute it with a less toxic chemical, then that is a form of substitution. Now, one of the things we'll have to acknowledge when we're dealing with a virus and we're dealing with people, as long as people are around and the virus is around, we're not going to be able to eliminate it. So that eliminates that top layer of our pyramid. Elimination can't be done by us because we don't have a way to physically do that as long as people are still coming. Same thing with substitution. We can't replace this virus with a less toxic virus. It just doesn't work that way. So we're going to be focused more on engineering controls, administrative controls, and personal protective equipment. And we're going to break those down so you have a little better idea of exactly what they are. But in order to get there, we have what's called our Swiss cheese model. If you ever looked at Swiss cheese, you know it has random holes in it in various places. As you cut through that block of cheese, the location of those holes changes. These are air pockets that are in the cheese. And so if you look on the left side, you have some sort of hazard event, right? And when it strikes that first layer of engineering controls, it's going to get blocked by some of that. But the cheese still has a few holes in it, so some of those hazards are able to penetrate even the engineering controls. So our next layer is going to be the administrative controls. And once again, if the holes don't line up, boom, we've got protection. And that, Swiss cheese is going to block it at that point. But there still may be some of those holes that are in alignment. And so that's when we proceed to the next one, which is behavior controls, which involves personal protective equipment. And that can provide a layer of protection. But sometimes, even through multiple layers of Swiss cheese, you have some holes that still line up and you have a potential incident. If we put the proper controls into place, that the effects of that incident should be minimized or greatly reduced. Maybe not all the way eliminated, but at least it gives you a better level of protection. And if you do have an incident because of it, then the consequences are going to be a lot less severe due to those mitigation efforts. So this kind of a visual, I think it's really helpful as far as explaining the process. So let's go into engineering controls. And what these are of the ones that we have left, this is going to be the most effective because it doesn't rely on people's behaviors. These are controls that you can put into place, whether it's increased ventilation. You see in the picture, I took this in a Costco restroom, and this is right after the pandemic started, and their physical barriers, they couldn't physically change the location of those faucets and the wash stations, so they put barriers in between them to help reduce any effect from one person to the next if they are going to be standing closer than that 6 feet. We may have to look at our workspace and see if we can reconfigure to create some spacing there. I'm sitting in a large classroom at our facility, and where we used to have 2 people at a table, now we have 1. Where we used to have 20 tables in the room, we have 9. And so we're now creating that spaces. We've reconfigured our education spaces, and we've done the same thing in our office. We staggered our work hours where we only had half the people at a given time. The other thing is, if you look in this picture, you see you have a lot of touch-free faucets and dispensers. So you wave your hand under that faucet, the water comes on, you don't have to touch anything. And same thing with the towel dispensers. You wave your hand and a towel comes out. So these are examples of engineering controls that don't rely on people's behavior, but they're built into your facility. Administrative controls, these are where people's behaviors start to come in. And so these are more training type things, workplace adjustments, staggering work hours, talking about safe work practices. Hey, it's important while you're here, try not to touch your eyes, your nose, your mouth. These are safe work practices. If you're using gloves, yes, they protect you, but you get an accumulation of things on those gloves. And if you go touch something else, now you're contaminating those surfaces. So dictate how often those gloves have to be replaced. Some companies, a lot of people have to travel. So you have to look at your travel policies and determine what is necessary travel and what isn't. Rearranging or scheduling now disinfecting procedures, so you have a specific time frame and structure to doing that, rather than just saying, you know what, that looks dirty, let me wipe it down. You now have a set time where you're going to do that. Signage, you see this a lot in the retail environment, lots of signs, some one-way aisles, a lot of markings on the floor for that 6-foot distance. We're seeing some of the plexiglass barriers at checkout areas. But the other thing is, you have to spend a lot of time on education and training. And this is, once again, the education and training is where knowledge is power, and that helps reduce stress, and it reduces anxiety and builds confidence. The signage that's shown on this page, how to stop germs. This was a CDC document that we've printed, right? So cover your coughs, wash your hands, avoid close contact, don't touch your face. It's basic stuff, but you don't realize how often you touch your face until you're made aware of it, right? We all do it, and it's a really difficult habit to overcome. And then the last thing I want to talk on controls is PPE. And so we're seeing a huge variety of things. We're seeing everything what we call just face coverings, because they're homemade a lot of times, like the picture on the right. We're seeing a lot of cloth masks and things like that. These are not intended to be real high level protections. Basically, the point of these is to capture those larger droplets. As we speak, if we sneeze, if we cough, those large droplets are expelled, and they're going to be captured for the most part, even in a simple cloth mask. Now, when we get into higher levels of protection, when we get into the N95s, and these are considered respirators. And the thing we have to think about here is, if you're going to specify a respirator, now you have some OSHA requirements involved in proper fit testing, how to use them, training, care, disposal, and in some cases, even medical evaluations before somebody's allowed to put on that respirator. Because maybe they have a condition like asthma and they already have some difficulty breathing. Well, when you put on a respirator that's going to restrict that airflow a bit, you might be causing a bigger problem. So the important takeaway here is PPE is your last line of defense. And if you can implement the other types of controls first, you should do that, because when the PPE fails, there's nothing left to protect the person from exposure. And so if you're selecting the PPE, you also want to evaluate what are the potential risks and what levels you need to use to mitigate those sorts of risks. All right, let's talk a little bit about OSHA record keeping and reporting. And the intent here and with my HR things is not to dig super deep into the weeds here, because this topic could be an all-day class all by itself, right? But we need to make sure that as business owners, we are following the proper processes. And OSHA just last Thursday came out with a new statement in regards to what you must record. And if basically you're required to record injuries and illnesses that happen in your place of business. And their initial guidelines were, well, it's really difficult to tell what came where and who was exposed where. So this is going to be a really difficult thing. Well, they've kind of brought forward a little bit more emphasis on the record keeping now. And they're putting the responsibility on the business owner to record illnesses that happen at their place of business. And if the illness is confirmed as a COVID-19 case, the illness is work-related, and we'll talk about how to determine that in just a minute. And the case involves at least one of the general recording criteria in 1904.7, which means days away from work, medical treatment beyond first aid, loss of consciousness, or restricted work or transferred to another job. That generates a requirement to record these things. Now, how do you determine if it's work related? There's not an easy answer here, but let's take a scenario that you have a business that has 10 people, and you had one of your people who was confirmed to have a case of COVID-19. And then somewhere down the road, you had other people in your business that also became symptomatic and were tested and confirmed. Now, we don't know what exposures these people had outside of work, but if you look specifically at what's in front of you, you have somebody that, yep, this person was diagnosed, and now we have a second person that was also diagnosed. You're going to have to come to the determination that it may have been work related, and out of the the guidelines recently issued, you need to record that. The thing to emphasize here is just because you record it doesn't mean you're in violation. The recording criteria is in place so you can track and document safety and health issues, but doesn't necessarily mean that you've done something wrong. And in this case, sometimes you cannot mitigate exactly how this virus is transmitted, even with your best efforts. Sometimes people do what people do, and they get closer contact, or something happens and there's an exposure that is beyond your control. But if you can evaluate it and come to a conclusion that there's a pretty good chance that the exposure took place in your workplace, you should record it. Now, reporting is a little bit different scenario. And OSHA requires you to report deaths and hospitalizations, amputation, eyes, that kind of thing. So don't confuse record keeping with reporting, because they have specific time frames you have to report some of these more serious injuries. But that's separate from record keeping. That is actually notifying them immediately within their time frame that this happened, or record keeping is more of an annual thing. Okay, so once again, our intent isn't to dig real deep into this, because it can be pretty complicated as you go through all the different scenarios. So This is an example of the OSHA Form 300. A lot of you are probably familiar with this. You've using this to log your injuries. And there are other forms that are in conjunction with this as well. So we just wanted to show you this one. So it's employees' names, title, date of the injury, where the event, and just kind of a description. So it's not a super complicated form, but these are records that you're required to keep. And if OSHA compliance officer comes to your business, they're going to ask you for this form. And maybe it's blank because you didn't have any, and that's fine. But if you've had any sort of incidents that require you to record them, you need to have this form ready and available for them to see. So let's talk a little bit about infection protocol. We have different levels of infection protocol. Primary is that individual has been diagnosed officially with COVID-19. So they are a primary source. In that case, you definitely want to quarantine that individual for up to 14 days, and they can only return to work after receiving clearance from a physician and a document negative COVID-19 result. So the process is you want to identify team members who's been in close contact with that individual. And close contact means being within 6 feet of the individual for more than 10 minutes at a time. You need to notify other members that may have been in contact with that so that they can pay more attention to symptoms and possibly get a test themselves. And then the area that they were in, you need to decide if you're going to quarantine that space for 3 days for self-sanitizing or if you're going to go in and physically clean it. So that's on the primary side. The next group of people would be primary symptoms that, and they've had a direct exposure to a primary individual. So we're going to take a similar process in that we're going to quarantine them as well if they've been in close contact with that individual. Or if in lieu of quarantining, if we have them tested and they test negative, then we're good to go. But we do want to identify people that are in contact with these secondary people. I shouldn't say secondary because that's the next one, but these people that were one step removed from the primary source. So then we have the next step, which is a secondary team member who was in contact with a direct team member, but not the primary individual. They were at a different level. And so you don't need to quarantine them, but they should monitor their own health and report if they begin to have any sorts of symptoms. And we also want to identify other team members that may have been in contact with them either down the line as well. There's really no action required with this person other than monitoring their potential systems and then kind of start to track what their exposures have been. Then the last one is tertiary, means they're about fourth removed. There's nothing you need to do them other than ask them to be vigilant and monitor any potential symptoms that they may have. So as we return, you may have some additional procedures you implement before people come into your building. And that would be in the form of additional screening measures. It could be interviews. It could be, hey, sign this, fill out this questionnaire. Have you been in contact with people? Have you traveled these places? Those kind of questionnaires. Or even a signed affidavit by my signature. I'm solemnly swearing that I've agreed to this, 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 and this. You may be trying to seek additional medical history. You might be doing some temperature checks. And so it's this medical history, these questionnaires, and the temperature checks that start to evolve into a little bit different area, which are HR considerations. And so when we talk about people's medical records and medical exams, the first thing that comes to mind for most of us is HIPAA. Everybody, it's a HIPAA violation. Well, HIPAA actually only regulates healthcare and healthcare providers and insurers. It regulates the need or the requirement to keep that information confidential. HIPAA does not apply to most businesses. Where other businesses have to comply, it's under OSHA regulations, ADA, and EEOC. Now, OSHA, because a lot of HR policies are directly related to OSHA compliance. So, and a lot of times, especially in a small business, the HR manager is also the health and safety manager. They kind of wear more than one hat. And so as a result of trying to comply with OSHA, they develop HR policies for people, and these are going to be administrative controls mainly, or PPE, that are directly related to what they feel their exposures are. But when we start talking about ADA, which is equal opportunity laws for people with disabilities, and the anti-discrimination laws, which also include age and disabilities. So there's some overlap and congruence into these laws and regulations. We have to make sure to, and if we're following the ADA guidelines, that we are accommodating people with various disabilities. We can't just automatically say, well, you've got this disability, so therefore we're not going to hire you. That's illegal. We also can't discriminate against people who've been exposed to a virus, for example. If just because they've been exposed doesn't mean they're going to be symptomatic or test positive. So we have to be really, really careful with these. And once again, this could be a multi-day presentation just on these. So, and I'll have to tell you right now, I'm not an attorney and I'm not a labor law specialist, but you do need to think about some of these things, at least on a basic level. And so when we're talking about the ADA and the EEOC portions of this, there's a couple things that are very, very important to remember. One is, once the pandemic was declared, that kind of altered some of the rules that are involved here. And the term direct threat is a really key term in ADA. Direct threat is a significant risk of substantial harm to the health or safety of the individual or others that cannot be eliminated or reduced by reasonable accommodation. If an individual with a disability poses a direct threat, despite reasonable accommodation, he or she is not protected under the non-discrimination provisions of ADA. So what that's saying is, a person that's been diagnosed with COVID is now considered a direct threat, which allows you to take some actions you can't take just generally for people. And along these same lines, the questions you ask people, and they could be with great intent. Hey, Bob, I'm concerned about you because I know you're a little bit older and I know you've had some health issues in the past, and we want to protect you, but tell me about what medical pre-existing conditions you have. You can't ask questions that are going to be directly related to revealing a disability. I don't have to tell you if I have asthma. I don't have to tell you if I have cardiovascular disease. That's my business. It's between me and my doctor, and you as an employer aren't allowed to ask these sorts of questions. When we talk about medical examination, temperature checks under the ADA is actually considered a medical examination. So once again, we have great intentions, but you have to be really careful with how these are done to protect people's privacy. So if you have people coming into your facility, you have 5 people lined up and you're taking their temperature using a thermal scanner, that's fine. But as soon as you announce somebody's temperature, you're exposing medical information for other people to hear. So you have to be really careful with these kind of things, because this is considered a medical examination. And then there's guidelines as to what temperature is kind of your cutoff for send them home versus let them in. And how you handle that is also going to potentially expose some of these medical information to other people. So once again, I don't have time to go into a lot of great detail here, but you do need to think about these kind of things. For example, if an employee comes back to work, you can't ask them, hey, does anybody in your family have COVID? That is a direct violation of privacy. However, you can ask, have you been in contact with anybody who's symptomatic with COVID? You can ask that question. So it's just a different one. Has to do with specific people. The other one's more open-ended. So once again, when we're doing these questionnaires and trying to gather information, once again, in the best intentions, you can very easily fall into some of these ADA and EEOC anti-discrimination type laws that are going to get you in trouble if you're not careful. Okay, and also under ADA, you have to make a reasonable accommodation for people that have disabilities. Now, once again, there's a lot of information to talk about there, but just make sure that if you have somebody that's identified with some sort of disability, you have to accommodate. Maybe it's work from home. If they're symptomatic but not tested positive and you want to quarantine them, okay, Bob, you work from home for the next 2 weeks and until this passes, and accommodate as much as you can that way to minimize this direct threat that they would have with other people. So I hope that helps. As we get through this process, we know restrictions are being lifted. We don't know enough about this virus to know if it's going to have a second round, if it's going to reappear. We don't know for sure how temperature, is it going to die off in the summertime but come back in the fall with flu season? There's a lot of unknowns here. So the important takeaway here is have a plan. Create a plan just in case. Hopefully you don't need it, but create a plan. As this progresses, we're learning a lot more about this virus and how it behaves and how it's transmitted. And it may or may not be necessary to have any sort of additional shutdowns. But you know, when we had this shutdown, a lot of us didn't have a plan and we just kind of winged it. At this point, have a plan on how you will proceed, and you're going to be a lot better prepared if it does happen. And this one is going to pass at some point, but you know, there's been other pandemics in the past. There's the H1N1, there was the 1918 flu. There's been a lot of other pandemics in the past, and there's going to be others in the future. So I can't emphasize enough, failure to plan is planning to fail. So make those plans, have them ready just in case. Hopefully you never have to implement them, but here we go. So on our last slide, as business owners, we got to be adaptable, right? And one of the reasons we are entrepreneurs, we're in business, is because we think we can do things better or more efficiently or more effectively and provide a service that nobody else can. We can do, but in order to do that, you have to be really flexible, right? You might have a plan that started here and it evolves into something else and it's even more successful. So you have to plan, you have to be able to adapt and kind of go with the flow, adjust to this quote, you see air quotes, new normal. But planning and adaptability will equal success. And I can't emphasize that enough, because if you don't plan and you don't adapt, you will not succeed. That's a given. So, you know, do your best planning. If you need some help, contact myself, contact Amber. I'm going to have our contact information at the end. We can help you through some of these processes. But at this point, we're open to questions.
All right, thank you, Ed. We appreciate that. We've got a couple of questions in the queue. Before we jump into those, if you could just go back to that OSHA website and just leave that up so they can go back and review that. We did have one comment that it was producing an error, so we'll make sure that everybody was able to copy that down correctly.
All right, let me see if I can get back to there. There, that one right there?
Yeah, that one right there, perfect.
Okay, very good.
So the first question we have is, do preschool programs need this OSHA form? We currently follow our ADHS regulations, which have a similar form required for communicable diseases.
ADHS regulations are separate from OSHA. They're two totally different agencies. Department of Health Services is a state agency, and they're more geared toward disease prevention, regulations, cleaning, those kind of things, whereas OSHA is all encompassing on everything safety. So the answer is yes. If you're in business and you have a certain number of employees, and I think the cutoff is around, actually OSHA covers any business with one or more employees. You're covered under the OSHA regulations. Now, as far as planning, there's some different steps there as to what you have to do based on the side of your business. But the short answer is, even though you're preschool and you have to follow state guidelines, you also are covered under the OSHA requirements. So yes, you do have to use that form.
Excellent, thank you. Then we have another one that says, you talked about engineering controls being the big factor into implementation. The slide with a Costco bathroom photo seems reminiscent of how public bathing stations looked in the 1980s when possible biological warfare during the Cold War, when tensions peaked. Do you think it could help to look back at an earlier era for ideas to better practices in helping justify through this pandemic?
Certainly, and that's a great question. And what I'm going to tell everybody in this case is, what have we done before, and what has worked before? And we don't have to reinvent everything. We do have a basis of regulations, processes, controls that have been effective in the past. And some of those are 50 years old. Some of them, just happened 2 weeks ago. The point is, we need to look at all different possibilities of controls. And yeah, if it worked and it was effective 50 years ago and it's still effective today, why not? Let's start there and then build from there, and then add additional controls to further enhance that. So yeah, something might have been something that was thought of a long time ago. A lot of these engineering controls are not new. They've been around forever and ever, but they work. And so that's why we keep seeing those.
Excellent, thank you. So Ed, don't have any more questions in the queue, and we're getting close to wrapping up. Would you like to take the last minute or two for some closing thoughts?
Absolutely. I want to start off by saying that we really appreciate the opportunity to communicate this information to the business community. We're here to support you. We are a safety and health organization. We are a nonprofit. We've been around for 119 years, right? I'm not quite that old, but I'm getting close. So we're here to serve you and help you and provide resources. Let me go to, if we're done with this page, I want to get to our links tab at the end, because it has a lot of really good links, whether it's the governor's office, the CDC, OSHA, EPA, EEOC, Department of Health Services. National Safety Council has formed a committee of people in the workplace from all over the country, really high level safety managers, officers, and they've developed this safer return to work that I just Google it or go to nsc.org. It's an amazing document that actually could be incorporated into some of the federal guidelines. It's put together by the highest level safety people from across the country. And we also have a link to a lab if you're considering doing some actual testing. You can contact the lab on what kind of protocols you have there. My information, Amber's information are both there. Amber, once again, Amber's much more versed on the OSHA side and the actual workplace side of things. I'm more versed on the safety training types of topics, but feel free to contact either one of us. And I want to thank everybody for participating today.
All right, Ed, thank you very much for all the attendees. This resource slide will be posted. We will post the recording of this webinar as well as the slide deck, so you'll be able to get these links when we get those posted up over the next few hours. Ed, again, thank you very much. This Thursday safety topic. Looks like we have one last question we'll throw in there. Where can our program find a plan to return to classrooms for the children ages 1 to 5 of age?
I can tell you the OSHA website that I gave you earlier, that link, it does have some very specific information for schools and daycare. So that would be a great starting point. And you can also contact the Arizona Department of Health Services for their guidance.
All right. Excellent. Thank you, Ed. We appreciate everybody being on this call, and we're going to go ahead and wrap up, and hopefully the rest of you, everybody can make it to tomorrow's marketing call. But have a great day, and we'll see you soon. Thank you.
Thank you very much.